Welcome to Stop, Look, and Listen, Practical De-escalation Strategies from Maryland and Delaware Federally Qualified Health Centers. We'd like to thank the following 6 individuals who have shared their voices of experience throughout this video. We appreciate their contributions to their individual organizations and communities and their willingness to share what they have learned and the wisdom they have gained and the advice that they have for you throughout this video series. Sometimes patients come in the door yelling. You haven't interacted with them yet at all. You don't know what they're upset about, but they come in the door and they are already very angry and very frustrated, and they are directing all of that anger and frustration at you. And in those circumstances, it can be very challenging not to react to that. But what you do when you are faced with that situation of a patient who is now angry, upset, frustrated, and directing those emotions at you, what you do in that situation is either going to make it worse or it's going to make it better. If you respond in anger, if you match the patient's tone, if you yell back, if you say unprofessional things, or you have a dismissive attitude, you tell people, calm down, why are you doing this? Responding in that way is going to escalate the situation. That means that the patient is just going to get more agitated, and it's going to make it worse, not only for the patient and for you in this visit to the clinic, but it may make it worse for future visits to the clinic as well. Because if you start arguing with the patient or interacting with them in a way where you're matching that anger, that frustration, then all that does is just continue to increase. On the other hand, if you take approaches to stay calm, to try to figure out what has the patient so upset and how you can resolve it, then you're going to be able to de-escalate that situation. The patient will settle down and you'll be able to move toward a solution.
Just reiterate that we are here to help, to please give us the opportunity to help, and of course apologize, for whatever issue they are bringing to us, and just let them know that we will help in any way to resolve the issue. Or sometimes I'll nod, yes, just listen and yes, I'm listening, trying to figure out where we can go through the situation that would accommodate you.
In a recent meeting, we asked clinic leaders to report what they have heard in their organization that should never be said to patients or colleagues. The most common answer was "not my job," and you can see that's repeated here multiple times. These other answers all come down to variations of "I cannot help you." We do not have enough staff. Who do you think you are? We're short-staffed. We can't keep telling you the same thing. You shouldn't be late. You didn't speak with me. I cannot help you. Any of these messages, however they are said, conveys to the patient a sense that you cannot help, which is the exact opposite of the message that you want to convey. Your words and your behavior really do matter in terms of the direction a situation is going to go with an upset or frustrated patient. If you think about a situation in which you personally have been frustrated or upset, in pain, when you needed to ask someone for help, think back for a moment and consider what people have said or done that has made you more upset in those situations, and what have people said or done that has made you feel better. You can also think about things that you have seen or overheard at your clinic, but jot down some notes because we're going to ask you about these at the end of this video. It's important to remember that many FQHC patients have experienced serious trauma in their lives. And as a result of those traumas, they may be experiencing anxiety, depression, post-traumatic stress disorder, or having other kind of consequences that affect their behavior and their interactions with you. Patients also may be used to being ignored or treated poorly. Developing trust is important and it truly may save lives. 44% of patients who skip appointments say that they do so because they've been disrespected in some way. And for those patients, if they don't come to their follow up appointments, depending on what their medical condition is and what they need care for, that may alter the course of their lives and in some cases may end up in a premature death because they haven't received the care that they need. So your words and your actions truly do make a difference. And no matter what your role is in your FQHC, you are saving lives. To de-escalate any situation with a patient, you can use the process of stop, look, and listen. You start by looking at the situation from the patient's perspective, considering whether they are scared or in pain, have they been ignored, and messages have not been returned from the clinic, so now they have arrived or they're calling agitated. Listen carefully to what the patient says. What is it that they're saying that they need? What is something that they're confused about? The more you understand by looking at the situation and listening carefully to what the patient says, the easier it will be to move toward resolution. Once you've looked and listened, then you're going to stop and use the stop process to move toward calm with that patient. Stop involves providing excellent service, taking the time with the patient and using teamwork to resolve their issues, exploring the options, and being professional and patient.
The idea of being able to say, well, let me talk to so and so and see if there's something we can do for you, as a way to create that space that just says, okay, let me get out of this situation right now. And even if you don't go talk to anybody, you just give yourself a breather and then come back and start trying to explain it again. But that gives you the time also to kind of go out and say, okay, how can I approach this differently? Go ask another person that, what it got any ideas, so that I think that's a good escape.
The S in stop is about providing excellent service.
It just comes down, I think, just to talking to the patient and seeing the patient and seeing their frustration and understanding what they're going through. Even if you have no idea, you just listen, and that counts for a lot in the patient. Sometimes they just want somebody to yell at for a little bit, or they just need to get something off their chest. Or they have every right to be mad because their prescription hasn't been called in and they've been out of their medicine for 2 days and they've been calling our office. So, you get the frustration and just try to get on their level and just understand. I look patients straight in the eye and I call them Mr. Smith, Miss Smith. Like, I understand where you're coming from. Let me see what we can do to fix this. And then, I'll do some research in the chart and see what else we can do. But then personally, I also look, just because I do outreach and I know, like, if we have certain funds that are good for certain things, like I'll check that also just to see if they would be eligible for anything extra, while they're in here, just to get that, because there's so many different grants and different things like that that they may qualify for and could eliminate, the situation.
Not everybody comes off having a great day, right? So I try and teach everybody who joins my team to go in thinking not everybody is in the best mood, but what can we do to make their day better? How can we help them? So, not to take things personal either. You never really know what kind of call you're going to get, or, what type of call the person that you're speaking with had before you that maybe upset them, or do we have long hold time? So it's always about putting in perspective and trying to think, we don't know what somebody else is going through, so really try your best to empathize with them, help them the best you can, be a very active listener. So I feel like I would want somebody who is also calm, and is doing well under pressure, because you don't know, the person coming in could be, very upset, very nervous, very scared, right? So you want somebody who's going to kind of help to bring them down on that level. And then you want somebody who's going to listen, because you want that person to feel like they're being seen and they're being heard, and you are, going to be there to help them. So, getting the knowledge from them on what the situation is, that's very important. Staying calm under the circumstances is very important. And then being understanding and, empathizing with them.
What you say matters, but your body language and tone also matter because patients will interpret your attitude from your body language and from your tone of voice. As you look at these two pictures, consider which person you think is more likely listening to you and willing to work with you to resolve your problem, and which one of them really is not interested in continuing the conversation and working with you. So if you find yourself getting frustrated or reacting to some things that the patient might be saying, take a moment and just consider how your body language and your tone will be perceived by the patient. Is the way you are communicating back to the patient helpful in terms of calming the situation down and resolving the issue?
Just giving them that space to be able to express their feeling, and again, the tone in which they might come in, really hot and angry already, but your tone coming in is a little bit more calmer, a little bit more caring. I think that will kind of help to de-escalate and to kind of reduce that fire, but at the same time, letting them express themselves, because sometimes that's all that they need. Sometimes they don't need us to, give them so much of an advice, but sometimes it's just more that they need somebody to listen to them, to know that, for them to feel like they are being heard. And sometimes it's just being quiet and just hearing them out. Sometimes does help to put out that fire.
The T in STOP is about taking the time and using teamwork.
We work in an area where we're within earshot of everything that is happening in our practice. And if, say, I'm talking with an irate person, and my lead person or another person is within earshot, a lot of times they'll walk over and say, maybe I can help with this situation. Why don't you come to my booth and we'll discuss this further. The team that I work with, we all work very well together in getting those type of situations calm down.
Teamwork with us is a huge thing as well. Like, we can't all handle everything. Sometimes a patient might be more comfortable speaking with a nurse, if it's medication related, or, we might need to send a message to a provider if they really prefer to, get their expert opinion. So it's all about finding out what you can handle and when to ask for help. We have a really great team, so all of us are comfortable speaking with each other and bouncing ideas off of each other and asking for help, because you can't do it alone. Everybody is going to need help from time to time.
Sometimes I use, seems like I'm not able to help you. Maybe my coworker in the next booth or my lead person can be more helpful. Let me send you to them. In fact, not too long ago, I had someone very irate. They wouldn't let me get a word in edgewise. This sounds like a different department issue, like a billing issue. Let me call someone who can speak with you. And the person is like, why can't you answer my questions? Blah, 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 blah. And it's like, let me get someone who may be more informative about questions that you're asking. Just kind of reiterate, I'm still here to help, even though I'm not able to answer your question.
The O in STOP is about offering options to help resolve the issue. In this section, we discuss 6 common de-escalation scenarios. As you listen to the scenarios, you'll notice that your colleagues are looking at the situation from the patient's perspective, listening carefully to what the patient has to say, and then using aspects of STOP to consider what the options are to resolve the situation. The options available in your clinic may vary from the options discussed here, but the important thing is to know what those options are in your clinic. And we encourage you to have a conversation with your colleagues about common de-escalation scenarios and what the options are to resolve them at your own facility.
I think it's also important too to kind of have a solution, at least for most things, you know what I mean, before you walk into it. So knowing what kind of options you have to offer in different scenarios, I think is important too. So like one, we get a lot, so we're a call center, right? Especially on like Monday morning, we can get really, really busy. So our hold times can be pretty extensive, depending on the day of the week, but specifically Mondays. So sometimes we'll get patients on the phone and they're just immediately upset about how long they have been holding. So I think, in a scenario like that, you can definitely explain, I apologize. We're having longer than normal hold times right now. We did just have a 3-day weekend. And then one of the things that we have as an option is a callback. So, when you get on the line, it tells you your anticipated hold time is 25 minutes. You can hold or you can press 1 to receive a call back and it'll hold your place in line. So anytime a patient is, upset about how long they've had to hold, we try to make sure they know that that is an option, because not everybody also is paying attention to the recordings while they're sitting there, right? Like they're multitasking, they're doing other things. So they might have, not heard it. They might be a little apprehensive about doing it, thinking it's going to drop their call and never call them back. But so we like to always offer that as an option as well when somebody is, upset about hold times.
If I have like patients who are a little bit more not too happy when they come in, sometimes it's just kind of like standing back and just letting them vent a little bit, trying to just let them know that, I hear them, I see them. Most of the time it's just listening to them and just letting them let out that frustration, and then, go in and just try to kind of talk them down in the sense of, okay, so what can we do different, to try to resolve whatever conflict or their feelings, and not to brush off that their feelings are insignificant, but let them understand, yeah, I empathize.
So this person is now ramping up. How do you ramp them back down? Situation that I'm talking about where the non-patient who thinks she's a patient is going off, not to just blow them off in terms of saying, well, you're not a patient, so I need to make you a patient, even though that's the explanation. You're having to, maybe you revert back to something that says, okay, I understand you're a patient, but I need these records to be updated, or coming up with something that sort of will kind of break through. The key is to get them to hear what you're saying. So you have to find a way to say it that they can understand. It's more about keeping calm and cool. You have to figure out kind of how to reach them in their state. So kind of meeting them where they're at and saying, okay, I understand that you really need to see somebody today. And I understand that you're in pain or you don't understand the situation. What I need in order to get you to see somebody is for these things to be done.
New patient appointments are difficult sometimes. So, we have some people calling, inquiring about new patient appointments. Those tend to go pretty quickly early in the morning, so if somebody calls like mid to late afternoon, we might not have anything available. So, that's again when we can offer alternatives. If you are insured, you can contact your insurance company to see if there's another option for you. We can give the numbers of other facilities that might be accepting new patients, in the FQHC world. So, we can try to give them an idea of, a better time that they could try to call to get in. And then, they could call the next day at, 8 a.m., 9 a.m., whatever, and then be able to get an appointment.
What I'm thinking about right now is like the pharmacy. So if a patient comes in, we've had a lot of issues with prescriptions lately. They haven't, whether they can't afford their medication or it wasn't called in. The first thing we'll do is look and see if they can't afford the medicine. Can we voucher it? So with our vouchers, you can use 3 vouchers a year or you can use $300, whatever comes first. So that's usually my first go-to if there's an issue with somebody paying for a prescription. But that's just, it's not written down anywhere. But then I just go, if we can't do anything, if we can't voucher, then I'll look at Walmart and see if they're on the $10 price line for 3 months. And if there's something else affordable, and if that doesn't work, I go back to the provider and ask them, hey, Mr. Smith can't afford this. Is there anything else? We checked at Walmart. It's not on the formulation list. Is there something else?
So, just by saying, this is why I need this information, I need to know the reason that you're coming in so that I know, which provider to properly schedule you with. So some people don't want to divulge that. Sometimes they just don't want to give it to whomever they're speaking with right now. So me as a manager, they may want to give that information to me. So not everybody is comfortable speaking with, the same person. If they feel like they're just speaking to somebody at the front desk who doesn't know anything about, their ailments, their medications, you might need to get somebody else involved.
The P in STOP means to be professional and to be patient with the patients.
They come in because, they're scared and they need help for whatever their situation is. And some people just react with anger when that happens. But I think the big thing is that you can't give, what you receive. And I think the trick is, instead of reacting, giving back what they give you, to remain calm and to keep your emotional cool, and trying to get them to, state what it is that they actually need. We had a situation where the patient, the front desk person went back to get somebody else and came forward, and this person said to the new person, oh, so you had to go get your guard dog. And so to respond to that, you could easily be like, I ain't your dog. Remember, to be calm and not to engage in the same sort of language or behavior, because that's your fallback position. To fall back into that is very easy, and to maintain that professionalism takes a minute.
I think it just all goes back to put yourself in their shoes and be patient. We ask for the patients to be patient with us, but we're not always so patient with them. They're just frustrated because they've called 5 times to get a prescription refilled and they're not getting the answers that they need. And now they're probably on their last dose and they're trying to figure out how they're going to get it. So just trying to put yourself in the patient's shoes and try to be patient with them and reiterate to them that you are here, you're going to help them. You may have called 5 times, but this is the first time I've interacted with you. See how far I can get with you today and see if we can't, if it's something with medications, let me see if there's an opening today and see if we can just get you put into the schedule so that we can resolve it. Just trying to not just do the de-escalation, but try to put yourself in their shoes and relate with them in any way that you can to try and calm the situation and just reassure them that you are here to help.
Exactly what it is. I mean, you got a fire going, but if somebody would just stop, if somebody would just stop and listen to the patient and take the time to talk to them, remove them from, the main lobby and let them go somewhere and scream if that's what they need to do, but then work it out, and figure out we're not going to continue the fire anymore. We stop here, and then you have a good relationship, with the patient every time they come in. I have patients from a couple years ago when they would come in and they're like, thank you again for being listening to me, and I'm sorry for yelling at you like that. But you're with the public, you gotta take it with a grain there. But if you can stop them from whatever and addressing their issues, it's going to help them a lot.
Thank you for watching Stop, Look, and Listen. More importantly, thank you for the work you do every day. It truly makes a difference. No matter what your role in your clinic is, your words and your actions change lives and save lives. Thank you for all you do for your patients, colleagues, and communities. Please take a moment to complete the brief evaluation form and let us know how we can best support you in the future.